Recurrent miscarriage means having 2 or more pregnancy losses in a row, usually before the baby can survive outside the womb. Think of it like a video game where you keep losing at the same early level. The goal is to find out why the game keeps resetting. Many things can cause repeat losses. Genetic problems like missing or extra chromosomes. Hormone imbalances, such as low progesterone. Structural issues in the uterus, like fibroids or a septum. Blood clotting disorders, for example, antiphospholipid syndrome. Infections. Imagine a garden. If the soil, the uterus, has rocks, fibroids, or lacks proper nutrients, hormones, plants, embryos struggle to grow. Often there are no clear warning signs, but some women notice heavy or painful periods, unusual bleeding after a miscarriage, or a family history of genetic disorders. A simple example, if you repeatedly lose a game after the same move, that move might be the clue. Similarly, repeated bleeding after a loss can hint at a problem. Doctors start with a detailed medical history, blood tests to check hormones and clotting factors, genetic screening of both parents, and imaging like ultrasound or hysteroscopy to look inside the uterus. Treatment depends on the cause: hormone supplements, surgical removal of uterine abnormalities, blood thinners for clotting issues, or IVF with genetic testing. It is like a mechanic diagnosing a car. First they listen, then they run tests, then they fix the specific part that is broken. While not all miscarriages can be prevented, steps can lower risk. Maintaining a healthy weight, avoiding smoking and alcohol, managing chronic illnesses like diabetes or thyroid disease, taking prescribed prenatal vitamins with folic acid, following any doctor-recommended treatments for known conditions. Think of it as preparing for a marathon. Proper training and nutrition improve chances of finishing the race. Recent advances include better genetic testing of embryos, pre-implantation genetic testing, and newer medications that target specific clotting disorders. Researchers are also studying the role of the immune system and the microbiome in pregnancy loss. For example, a 2023 study showed that a short course of low-dose aspirin plus heparin